Addiction is everywhere. From social media to food, drugs, and alcohol, it's never ending. But the most devastating addiction is the opioid epidemic that's going on today. And that's with heroin, synthetic drugs, prescribed medicines, and that list just goes on and on. And there are some factors that play into this epidemic: age, gender, ethnicity, geographics, but also mental illness and disorder. But let's dig a little bit deeper. Addiction alone isn't the main problem. It's also the issue of inappropriately handling mental health, and also monetary incentive to hospitals and their staff. Let me clarify, mental health needs to be a primary factor for evaluating someone who struggles with addiction rather than the underlying issue. And big pharma companies need to be held accountable for when they use our mental issues and health to gain profit. Around 1 in 4 that have severe mental illness, or SMI, also have a substance use disorder, SUD. I can attest to this fact personally because my dad, for decades, has struggled with drug and alcohol addiction, and he was diagnosed with a mental illness when he was an adolescent. But because they didn't catch it in time, he's now developed into an addict. So according to the drugabuse.gov, mental illness may precede a substance use disorder, SUD, suggesting that better diagnosis of youth mental illness may help reduce comorbidity. In other words, a person shows presence of 2 chronic diseases or conditions at the same time. And I'm sure there are people here that have either had people close to them battling it, or they themselves have battled something with either mental illness or drug addiction, or the combination of the two. There are some ways to help prevent or intervene with those battling MSI and SUD simultaneously. I previously stated that adolescent testing for mental illness and having the right treatment available can help to battle addiction issues. I would also highly advise some sort of counseling for both children and guardians in learning ways to cope with those issues, and also getting mental health needs for those battling these same issues that are already in adulthood. As Austin Eubanks said in his TED Talks, that in 1996, the American Pain Society added pain as the 5th vital sign when you go and check into an emergency room. Once this policy took place, hospitals and doctors were now being compensated to have patients do surveys, and the surveys came back as high-quality patient satisfaction when it came to pain management. In that, you can see where the slippery slope can develop. Now, that's not to say there wasn't an opioid problem prior to 1996, but that definitely didn't help. And we can see by this chart that in 1995, HIV/AIDS killed 43,115 people. As of 2015, the drug overdoses alone killed more than 52,000 people. So we know that it's been going on for a lot of years. So to recap, there needs to be earlier mental health testing in adolescents, and the compensation for better patient care needs to be either stripped or revisited with more strict guidelines. Let me paint a picture. If mental illness and proper treatment were caught before depression, anxiety, etc. follows up into adulthood, there is a chance that counseling, leaning into our issues, leaning into our illnesses, not running away from them and shying away from them, could prevent us from continuing down the path of opioid destruction. Also, holding these businesses accountable for their compensation ploy would be an example to future businesses when taking advantage of someone's health just to gain profit. So I leave you with this. I leave you with this challenge. First, realize that it takes every voice to make a big impact. The louder our voices, the better chance we have of making a difference. Write your congressman. Join AAOA, which is Allies Against Opioid Abuse, or any other organization that fights against this debilitating disease, and get educated on early stages of mental health issues to have either your loved one or yourself properly treated before it's too late.